very good afternoon to all of you. I'm Dr. Manisha. I'm currently working as a medical affairs lead in Lupin Medical Affairs Division. I am basically this meeting has been arranged for with the objective of having some patient awareness around mental conditions generally associated in patients with gynecological disorder, especially PCOS. So here joining with me is Dr. Kriti Anand, a very well-known psychiatrist. So, ma'am, welcome you in this program.
Thank you.
Thank you, ma'am. Thanks for coming. And here, if you see that around our routine life, there are so many patients of PCOS, and it is becoming very common amongst women, particularly in teenagers, even in young females, middle-aged women. It's across age group, it is very common. And there is also been seen that there is increasing evidence of having some mental condition or psychiatric disorder associated with it. So can you give us more information about this, how commonly it is present?
Okay, so we'll talk about PCOS a little bit and then we can go to the psychiatric disorders which are related to PCOS. So PCOS, as you told, is actually very, very common, and it's a endocrine condition or disorder which is found in 15% of women in reproductive age group. So that's quite a lot. So we see in young adolescent and young adults, people who want children. So kind of there is a triad of symptoms in PCOS along with multiple symptoms such as oligomenorrhea or amenorrhea or menstrual irregularities, subfertility or infertility, hirsutism, acne, alopecia, anovulation, weight gain, obesity. All these are symptoms which is associated in PCOS. So because of all these symptoms and because of hormonal and neurotransmitter abnormalities also, we have seen that there is quite an incident of psychiatric disorders which are related to PCOS. So we have seen that around 3 times more anxiety and depression are more prevalent in the people who are suffering through PCOS rather than in the normal population. So we can see a multiple amount of disorders such as anxiety, depression, OCDs, somatization. All these disorders are more commonly present in the people who are suffering with PCOS.
Great, ma'am. Yes. So I understand this is very common disorder, and we can see around prevalent, quite very prevalent in the society. There is one more thing I would like to ask you. So how it is means generally patient this PCOS syndrome is a conglomeration of multiple signs and symptoms in women. How we can identify, and we can actually early intervention in case if you want to have the consultation with the psychiatrist, how we can identify in the early stage such disease?
Usually the patient with PCOS or the PCOS is diagnosed primarily by the gynecologist. So when the patient goes to the gynecologist, screening is required. So PCOS is not just one time, it evolves over time. So if somebody is diagnosed with PCOS, only one time assessment of psychiatric disorders is not enough. So every time the patient goes for a follow-up, a gynecologist or any other doctor who's seeing or is diagnosing the patient with PCOS should screen a little bit for psychiatric disorders. If any psychiatric disorders such as anxiety or depression or sleeping abnormalities or excessively mood swings or any other disorder is suspected, then they should be referred to a mental health expert or a psychiatrist for improved treatment so that the PCOS as well as the psychiatric diagnosis which is associated with it can both be corrected at the same time.
Right. So my next question is about managing such elements, psychiatric elements in patients. What is the importance, or what you can say is how generally these patients are managed in the clinical practice from psychiatric perspective?
Usually the patients with PCOS have multiple symptoms which is exaggerating the mental health issues. For example, there is seen that because of infertility and because of alopecia, a lot of people go through anxiety disorders and people with the acne, they go through a lot of depression. And because of obesity and hirsutism, it's seen that there is a lot of stigma among women, which leads to decreased quality of life. So we see a multiple features of PCOS which is associated with them, leading to small stressors which are leading to psychiatric disorders. So first we need to understand what the stress is there and what are the symptoms. It's usually we see that usually anxiety, depressive, mixed episodes are seen with the patients with PCOS. So it can be treated in various number of ways. Usually, we prescribe the first most, which is important both for PCOS and psychiatric, is lifestyle management, which is very, very important. Mindfulness, yoga, meditation, lifestyle management, such as diet regulation and proper exercise, can also be beneficial both for mental health as well as the PCOS symptoms. If we see that the patient has moderate to severe psychiatric symptoms, then we can always go for therapies such as psychotherapy, or what we call it as talk therapy, or we can go for even medications, which are very, very safe and safe for PCOS also. And it leads to great improvement and decreases social anxiety, which is associated with PCOS.
Okay. Yes. So we have reached actually at the end of this session. So at the end, you would like to give some message or final takeaway message for our viewers.
I think PCOS is very, very common nowadays, and people should not be that stigmatized being diagnosed as PCOS. And it has a treatment if we go to the correct people. And if psychiatric disorders are also associated with PCOS, it should be diagnosed at a very early stage so that we can get better results. And we should not be worried about having PCOS and other psychiatric disorders as well. It can be treated and managed very well, and which can lead to better results in long term.
Great. So thank you, Dr. Kriti, for coming here and sparing the time from your busy practice and giving us these important insights. And that would be really beneficial for our viewers also to understand how important it is to seek the help from other people when they are facing such kind of mental illness associated with gynecological disorder. Thank you, ma'am.
Sure. Thank you. Most welcome.
Great.